Vagus nerve. Vagus nerve is mainly a parasympathetic nerve. This parasympathetic nerve innervates the motor function of the viscera. The motor function of the viscera and also the muscles which are derived from the branchial arch, like the muscles of the larynx, the muscles of the pharynx, the muscles of the soft palate, okay, the smooth muscles of the esophagus, of the stomach, of the colon, of the intestine. All of these muscles are innervated by parasympathetic fiber of the vagus nerve. But also the vagus nerve has some somatic fiber. This somatic fiber which innervates the external acoustic modules. Okay, some fiber from the vagus nerve innervate the external acoustic modules, which are somatosensory fiber, and also some of the fiber are gustatory fiber, which are the fiber for the taste of the anterior part of epiglottitis. As you know, your taste is from the tongue, from the palate, and from the epiglottis. The taste fibers from the anterior part of epiglottitis are transmitted by the vagus nerve. Okay? So, the vagus nerve exists from the skull by which foramen? By the jugular foramen. Okay? When exists the skull from the jugular foramen, it inserts to the carotid sheath. At the first part of the vagus nerve, we have two ganglions. At the first part, we have two ganglions here and here, as you can see. Superior ganglion and middle ganglion. The superior ganglion is located just near the foramen, the jugular foramen in the skull, and the inferior ganglion is located inferiorly in the neck. These ganglions have several fibers. What are the ganglions?
Connection of cell bodies.
Yes, they are collection of the cell bodies. Okay, so these cell bodies, I am saying that the main part of the vagus nerve is parasympathetic fiber. Okay, the sympathetic and parasympathetic has presynaptic neuron and postsynaptic neuron. Okay, these ganglions are the site of synapses, the presympathetic and pre and postsynaptic fiber. So, from superior ganglion, two branch is divided. One branch is meningeal branch, which meningeal branch turn to insert another again in the foramen, in the jugular foramen, and innervate the meninge of the posterior cranial fossa. Okay, meningeal branch from the superior ganglion. Another branch from the superior ganglion is auricular branch. Auricular branch innervates the external acoustic modules. It has somatic fiber, somatosensory fiber for the external acoustic modules. These two branches are derived from the superior ganglion. Another branch are derived from the inferior ganglion. From the inferior ganglion, the branch of the vagus nerve, the first is superior laryngeal nerve. Superior laryngeal nerve. The superior laryngeal nerve comes and travels inferiorly, and at the level between the external and internal carotid artery, it divided in two branches, external laryngeal nerve and internal laryngeal nerve. Internal laryngeal nerve is a sensory nerve. Is a sensory nerve which pierces the thyroid membrane. Here the thyroid membrane and made the sensory innervation of the larynx, inferior to vocal cord. Sensory innervation of the larynx inferior to vocal cord are carried by the internal laryngeal nerve. Okay? External laryngeal nerve innervates the cricothyroid muscle, a muscle which is located at the anterior triangle. Cricothyroid muscle is innervated by external laryngeal nerve. So, superior laryngeal nerve has motor branch for the cricothyroid. It has sensory branch for the larynx. Okay? And also the external laryngeal nerve innervated the inferior pharyngeal constrictor. Inferior pharyngeal constrictor. We have three pharyngeal constrictor: superior constrictor, middle constrictor, and inferior constrictor. Okay? Inferior pharyngeal constrictor also are innervated by the external laryngeal nerve. External laryngeal nerve. Another branch from the vagus nerve are the cardiac branch. Cardiac branch is derived from which ganglion? Inferior. All the branch are derived from the inferior ganglion except of two branches, meningeal branch and auricular branch. Meningeal and auricular. The cardiac branch insert to the cardiac plexus. We have two cardiac plexus, superficial and deep cardiac plexus, which the parasympathetic fiber of the cardiac plexus are derived from the vagus nerve of right and left from the inferior ganglion. Okay? Another branch is the inferior laryngeal nerve. Inferior laryngeal nerve. Inferior laryngeal nerve is also named recurrent laryngeal nerve. Why we named it recurrent?
It encircles the aortic arch.
Reverse back to
It goes upward
It
again.
retains, yes, because it retains and goes superiorly. In the left and in the right, it is different. Its root is different. In the right side, the recurrent laryngeal nerve, or also is named inferior laryngeal nerve. In the right side, as you can see, when the valgus nerve arrive at the level of right subclavian artery, this nerve is derived from the valgus nerve and runs this artery. What is this artery? Subclavian. Subclavian. Anterior, inferior, and posteriorly runs the subclavian artery and travels superiorly to arrive to this area. Travels superiorly to arrive to this area, to the larynx. Okay? And it innervates the sensory part of the larynx inferior to vocal cord. Superior to vocal cord is innervated by internal laryngeal artery. I said that here at this level, we have the superior laryngeal artery. Okay, and at this level we have inferior laryngeal artery. Superior laryngeal divided into internal branch and external branch. Okay, internal branch made the sensory fiber for the larynx superior to vocal cord. Recurrent laryngeal or inferior laryngeal or also is named inferior laryngeal nerve made the sensory branch for the larynx inferior to vocal cord. It is the root of the recurrent laryngeal nerve in the right side. But in the left side, the recurrent laryngeal nerve is derived from the vagus nerve just at the level of aortic arch. At the level of aortic arch, and it runs the aortic arch anteriorly, inferiorly, and posteriorly to return to the upper area. What do you think about this difference in the right and in the left side?
Left recurrent is larger than
Left is
larger.
larger. No. It doesn't depend on of the longer and larger or the shorter. Why in the right side recurrent laryngeal nerve derived from the vagus nerve at the level of subclavian artery, but at the left side recurrent laryngeal nerve derived from the vagus nerve at the level of aortic arch? Because in the right side, the subclavian artery is a branch of brachiocephalic artery. Okay? It derives from the brachiocephalic artery at this level, at the level of sternoclavicular joint. But left subclavian artery is a branch of the aortic arch. Okay? So, it was the branch of the vagus nerve which derived in the carotid sheath. And the beginning of vagus nerve insert to the thoracic cavity and then insert to the abdomen through the esophageal foramen of the diaphragm, and it made innervation, visceral innervation for all the viscera of the thorax, all the viscera of the abdomen, until medial 2/3 of the colon. Okay? Medial 2/3 of the transverse colon. We have transverse colon, this transverse colon. Superior to transverse colon, we have ascending colon, we have the intestine, we have the duodenum, yes, we have the stomach, and we have the esophagus. All of this area are innervated parasympathetic fiber of vagus nerve. But after 2/3 of the transverse colon, we have 1/3 of transverse colon, descending colon, sigmoid colon, yes, and rectum. All of this area are innervated by the visceral plexus of the pelvic. Visceral plexus of the pelvic. Okay. What do you think about this function? It is a reflex. It's named gag reflex. Have you ever visited by a general physician during an adult call, during a call? Yes? It made a sound in your pharynx, and the gag reflex is a reflex in the beginning of the nausea, of the vomiting.
Yeah, vomiting.
Okay? Why it is created? What do you think? Why it is created? This reflex? During the irritation of the pharynx. Why?
To check the function of muscles of the soft palate.
Yes, the function of the muscles of the pharynx. I said that the muscles of the soft palate, the muscles of the pharynx, okay, are innervated by parasympathetic fiber of vagus nerve. So, when you irritate this fiber, you are irritating the vagus nerve, okay? And vagus nerve is a parasympathetic fiber, and this reflex begins, which is named gag reflex. The vagotomy in some patients which have peptic ulcer in the stomach, we may need to do the vagotomy surgery. After vagotomy, what begins and what change begins in the patient? And why we do vagotomy? Vagotomy means cutting the vagus nerve. I said that vagus nerve is a parasympathetic nerve. Parasympathetic, I mean that it makes the secretion of the glands in the stomach, the glands in the duodenum. Okay? During the hypersecretion of this gland, okay, because of the acidity of the stomach, you may have peptic ulcer. Okay, if you cut the vagus nerve, you are reducing the secretion of this gland. Okay, and you help the patient to be better, to have lower acidity, to have lower secretion. Sympathetic trunk. Sympathetic trunk is located posterior to carotid sheath. From first, I know I am talking about the SCM area from superficial to deep. Okay? After carotid sheath, now we arrive to the sympathetic trunk. The sympathetic trunk or the sympathetic chain is located parallel to the vertebral column at the cervical ridge until the coccyx. Okay? At the first, we have the sympathetic ganglion at the level of every vertebra. Okay? At the level of every vertebra. For example, we have 7 cervical vertebra and we have 7 sympathetic ganglion at the cervical area. We have 12 thoracic vertebra and at the first we have 12 ganglion, sympathetic ganglion. But some of these ganglion are merged together. In the cervical area, we just have several ganglion. We just have 3 cervical ganglion. Superior, middle, and inferior. Okay. Inferior cervical ganglion attached to the first thoracic ganglion and made a ganglion which is named stellate ganglion. Stellate ganglion. So, the presynaptic fiber, the presynaptic neuron for the sympathetic fiber is located in the lateral horn of the spinal cord. Okay? The lateral horn of the spinal cord is seen in the spinal segment from T1 to L2. Yes, from T1 to L2. So, I want to say you that all the sympathetic fiber from the head and neck, their origin is located in the spinal cord at the level of T1 to L2. This presynaptic fiber insert, see here, T1 to L2. Okay? This presynaptic fiber insert to the paravertebral ganglion, and some of them synapse at the same level. Some of them synapses at the same level to arrive to the every part of the body. Some of them travel inferiorly, and some of them travel superiorly. This fiber which travels superiorly arrive to the inferior, middle, and superior cervical ganglion. Okay? And then from this ganglion, several branches are derived. Which branch? See here, it is parasympathetic ganglion, which parasympathetic chain, sympathetic chain, which is located in the paravertebral area from C1 to coccyx, okay, in all the sides. Here is presynaptic ganglion. Presynaptic ganglion is derived from the lateral horn at the level of T1 to L2 and insert to the sympathetic trunk, and in the cervical area they travel superiorly to arrive to the superior, middle and inferior cervical ganglion. From this ganglion we have three types of the nerve. One type are spinal nerve. Spinal nerve. When I say spinal nerve, how many spinal nerve in the cervical are seen?
8.
8. Okay, 8. From three ganglion, 8 spinal nerve are derived and insert to the spinal nerve, which carried by all the area. For example, insert to the cervical plexus at the level of T1, at the level of C8, C7, yes, C6, C5. They insert to upper limb, brachial plexus. Do you remember the brachial plexus? Yes. So the sympathetic fiber for the brachial plexus are derived from this ganglion, superior, middle, and inferior ganglion. So some fiber are spinal ganglion. Some fiber are vascular ganglion. For example, the sympathetic fiber which arrive to the brain. Okay, they travel during the vascular which arrive to the brain. Internal carotid artery, internal jugular vein. They have the sympathetic fiber, which this sympathetic fiber derived from this ganglion. From superior ganglion, we have jugular nerve and carotid nerve. Carotid nerve travel through internal carotid artery, arrive to the brain. Jugular nerve travel through internal jugular vein, insert to the brain. Okay? From middle cervical ganglion, we have thyroid nerve. What means thyroid nerve? Thyroid nerve means a sympathetic nerve which travel through superior thyroidal artery and arrive to the thyroid gland. From the inferior ganglion, subclavian nerve. What is subclavian nerve? Subclavian nerve is the nerve which arrives to the upper limb, subclavian nerve, and also vertebral nerve. Vertebral nerve is a nerve which is located during the vertebral artery and also arrives to the brain. They are vascular nerve. So one type were spinal nerve. One type is vascular nerve, and another type are cardiac nerve. Cardiac nerve arrive to the cardiac plexus